Heavy periods are what a woman experiences every month that may decrease their quality of life, take them away from having to go to work or taking care of their children and families. Heavy periods for symptoms can usually mean having to change a pad in less than 1 hour, having to have a blood transfusion, or having to see your doctor regularly because of the heavy periods. Heavy periods affect 1 in 5 women, which is more than people expect. Usually we see that throughout the reproductive years of a woman. However, that usually is seen through the ages of 35 to 42. One of the biggest misconceptions about heavy periods is that there's an actual abnormality of the uterus and it may require a hysterectomy. A hysterectomy is not always needed for heavy periods. In fact, some of the causes of heavy periods include fibroids, polyps, and sometimes hormonal imbalances. Fibroids are actually the most common benign tumor of the pelvis, and they are smooth muscle tumors that can grow to various sizes. In fact, up to 50% of women by the time they are 50 have fibroids, and up to 70% of African American women by the time they are 50 have fibroids. The different types of fibroids actually are related to the location in the uterus. You can have fibroids that are in the cavity of the uterus, you can have fibroids that are in the muscle of the uterus, and sometimes fibroids are on the covering of the uterus on the outside, and that leads to what types of therapies and treatments are available for women depending on the types of fibroids that they have. Polyps are overgrowth of tissue that can occur in the cavity of the uterus and contribute as well to heavy bleeding. Heavy periods can start as early as in your teens. It is always best to have a very good relationship with your gynecologist so that when you do start to have heavy periods, you can talk to your doctor and talk about treatment plans. Women who have lighter cycles or regular cycles throughout their lifetime, however, notice a change in their quality of life or how much they are bleeding, should see their gynecologist at that time because there may be a change in hormones or in the structural abnormalities of the uterus that may cause their heavy bleeding. Lifestyle changes can absolutely help manage the symptoms of heavy bleeding, and some of those changes include changing your diet and increasing your green leafy vegetables, increasing your water intake the week prior to your cycle, as well as decreasing alcohol consumption. It's also important to incorporate activities that reduce stress, as well as incorporating activities such as acupuncture or meditation, and making sure that you exercise on a regular basis. The ways that we can deal with this heavy bleeding is to talk to their gynecologist for options such as medical management, which can include any type of contraception, any type of intrauterine device, to even medications that can affect you having periods at all. Depending on the location of the fibroid, for women who do desire to have children in the future, they can consider a myomectomy. Myomectomies require removal of the fibroid tissue from inside the muscle of the uterus, however, keeping the uterus intact. For women who have had heavy bleeding for many years and failed medical management or do desire to have their uterus removed, can resort to having a hysterectomy as their option. For women who experience heavy bleeding and are finished with childbearing, however, do not want a hysterectomy, they should talk to their gynecologist about an option called endometrial ablation. An endometrial ablation is when the lining of the uterus is treated in order to minimize bleeding. Every woman experiences heavy bleeding differently, and that's why they should have a great relationship with their gynecologist to go through all these options, such as medical therapies, procedures, and even surgeries.